Hi, I'm Kristen Taylor. I'm a physical therapist with Midwest Orthopedics Rush Physical Therapy. In this video, we're going to do crutch training, teaching you how to walk with your crutches. It's best if you try to do this before you have your surgery to make sure that you're safe and comfortable using them prior to surgery. For your setup for your crutches, it's important that you leave a little bit of space between the axilla and the crutch. There's a lot of important structures in the armpit, nerves, and vascular structures that we want to make sure that we're not weight bearing through. And when we look at where the hand placement is here, we want to make sure that there's a slight bend in the elbow, approximately 30 degrees, but a slight bend is the best way to kind of think of it. We want to be standing pretty upright, and we want to keep the crutches close to our body because we're looking at them as an extension of our legs. The other thing to note is that we'll be on crutches up to 3 weeks. So when we are 1 day after surgery, we're thinking that we're approximately 20 to 25% weight bearing. What does that mean? That means if you had an egg underneath your heel, you don't want to crush the egg. So we can put our foot down for balance, we can put our foot down for gait, but we want to make sure that we're not weight bearing too much through that foot. Over time, over the course of 3 weeks, you're going to progressively increase the amount of weight that you're putting through that leg with your physical therapist. At 3 weeks, we should be at 100% weight bearing, and that's when you'll start to wean from use of the crutches. This process can take up to 2 weeks for some individuals, so be patient with this and use your physical therapist as a resource for getting off of crutches. So now we're going to demonstrate how to walk with those crutches. We're going to use what's called a step 2 gait pattern. So you'll remain tall in your walking, keeping some space between the crutch and your axilla. You're first going to advance the crutches, and then your surgical leg, and then your non-surgical leg. So we're going to keep moving forward, our crutches, surgical leg, non-surgical leg. When we're turning, it's also important to make sure that we're not planting and rotating over a planted foot. So we're going to make a gentle U-turn. So he's going to continue with that crutches, surgical leg, non-surgical leg pattern. And then you can see from behind too, we're keeping those toes pointing forward. We're going crutches, surgical leg, non-surgical leg, placing just approximately 20 to 25% of weight through that limb. In this video, we're going to review how to negotiate stairs after surgery while using your crutches. It's really important to remember how much weight bearing you should be doing right after surgery. So day 1 post-operative, we're at 20 to 25% weight bearing, so we're not crushing an egg. And then progressively with physical therapy, you'll be increasing the amount of weight that you're putting through that leg up until 3 weeks where you're at 100%. So we're going to pretend as if this is day 1 after surgery, so Chris is only going to put approximately 25% of weight through this leg. So the way that we're going to go up to the stairs is we're going to go up to the step and be close. We're going to keep the crutches with your feet on the ground to start. You're going to accept the weight into your arms to offload your leg. We're going to go up with your non-surgical first, and then follow with both the crutches and the surgical limb. On the way down, what we're going to do is the crutches are going to go down first, and then we're going to lead with the surgical leg, and then follow that with the non-surgical leg. We're going to have Chris go one more time to show you. So he's going to turn around, he's going to come close up to the stair. He's going to keep the crutches at the ground level. We're going to lead up with the non-surgical. Crutches will then go down. We're going to lead with the surgical leg on the way down, and then meeting the crutches there.